Hello, my name is Robert Ferdinand. I have sickle cell SC disease, which is a version of sickle cell. It's seen as the second most severe condition. What it means is that a good amount of my blood is sickled, and then the rest of my hemoglobin carries the C trait. So currently, right now, I'm about 60% sickled, 30 odd percent with C trait hemoglobin, and then a small remnant of healthy hemoglobin. I was diagnosed officially with sickle cell disease in January of 2017 at the age of 27. I was misdiagnosed multiple times throughout my childhood and teenage years with different afflictions, whether it was asthma or vagovascular syncope, just because it was something that was overlooked at the time of my birth when it more than likely would have been discovered. I was told that the state of Hawaii, where I was born, wasn't doing birth testing for sickle cell, so it was something that was completely overlooked. And on a whim, just by going into the doctor's office, they noticed that I had a discrepancy with my white blood count and decided to dig a little bit deeper, and that's when we stumbled across my actual condition. Since the diagnosis for sickle cell, I've had a few different options. The first option that I went through was rounds of chemo. There is a drug called hydroxyurea that they give to you in a pill form that you take daily, and couple that with folic acid to help replenish certain things in your body. However, that treatment did not go well for me the first time around, just because it wasn't observed well enough by the doctor. As the dosage ramped up, it ended up stopping hemoglobin production in my body completely. I went from was around 13 percentile of hemoglobin for male. It's seen to be healthy if you have 17 percentile. And I went from 13 to 3% and almost died. I needed to do blood transfusions in order to replenish myself. And blood transfusion is also another form of treatment where you basically replace the sickled hemoglobin in your body with healthy hemoglobin. I've also been scanned for a bone marrow transplant. I was a possible patient for that, which is due to the high risk reward of the procedure and not having a perfect match, along with the fact that sickle cell SC sometimes isn't severe enough to justify the risk. I wasn't able to do that as well. So for sickle cell as a whole, it just seems to be a very hard thing to treat. Either you have to be on the brink of death, or you basically have to just struggle through it as best you can. Finding out that I had sickle cell has been quite an experience, especially at the age that I did. I had had multiple trips to the hospital for chest pains, body pains, fatigue throughout my years, but was always told by doctors that I was healthy because most of my blood tests came back fine. And I mean, other than being underweight, I had always seemed to be a fine specimen of health. So mentally, it's kind of a trip to be told throughout your years that you're okay, but not feeling okay, especially dealing with the day-to-day pains that come with sickle cell. So finding out and knowing what it is has been a relief in itself. going through treatments and the ups and downs of trying to be treated and trying to find a way to fix it has been difficult. But I mean, it's been a journey, and I hope that getting these stories out and bringing awareness to sickle cell is going to help other people out and, give people the will to fight. And if I can do that, then the experience is enlightening and empowering in its own self.